Okay, so my name is Taylor Vota, and this is my final project, and I chose to do manual development, and I did parenting children with ADHD. So this is basically a guide to dealing with hyperactive children. So obviously the first step in ADHD and understanding it is knowing exactly what it is. ADHD stands for Attention Deficit Hyperactivity Disorder, and it's a developmental disorder that mainly affects one's self-control. The significant issues associated with ADHD are impulse control, hyperactivity, and attention span. ADHD affects the frontal lobes of the brain where thinking, focusing, concentrating, and decision making occurs because of excessive brain inactivity. So the next question would be, how is this inactivity caused? So we know that brain cells communicate by releasing neurotransmitters between one another across a synapse. The gap between cells is called a synapse. When neurotransmitters are released, basically, in order to communicate with the cells, they have to avoid a reuptake system. A reuptake system is essentially something that just pulls whatever the neurotransmitter is that's being released back into the original cell, and so it isn't communicated to the other cell. Dopamine is a neurotransmitter that's associated with attention, thinking, controlling our moods, and movements. So when you're affected by ADHD, the dopamine released is reabsorbed by a reuptake transport system 70% more than those who are unaffected. So the dopamine that's being released in brains with ADHD is being reabsorbed by the original cell as opposed to being communicated to the next cell. So when this dopamine isn't transmitted, it makes communication in the brain difficult. This lack of communication is what makes daily activities harder in those with the disorder. So this is just a brief diagram of a brain structure associated with ADHD. You can see here that this is the prefrontal cortex, and that's where the part of the brain is affected by ADHD. So this is an example of a synapse between the two cells within the brain, and this is a reuptake dopamine transporter system. So when the dopamine in brains with ADHD is released, it's in this reuptake system as opposed to being communicated to this receptor cell. So the causality of ADHD. So how it's caused. It affects about 3% of the population, but if a parent has a disorder, the likelihood that your child will have it increases significantly. So it is genetically inherited, but you can't give it to your child. It's not caused by poor parenting or too much sugar or vaccines. And the traits that are inherited are usually a lack of dopamine receptors and transmitters. So again, that's what makes the communication difficult within the brain. So what to expect in a child with ADHD? Hyperactivity is one of the main components of ADHD. It includes excessive energy, inability to sit still, fidgeting, and lack of tiredness. They move more than other children. Movements are purposeless or inappropriate. Unable to focus on the task at hand. They won't stay in their seat. They'll run when they're supposed to be walking. They'll touch everything within reach, and not only will they touch it, but they'll leave like a path of destruction behind them. Impulsiveness is another factor that occurs within ADHD. So it's basically lack of self-control. So blurting things out in class, interrupting during conversations, making dangerous decisions. It just doesn't occur to them that there are consequences to those decisions. Basically, they're not thinking before they're doing. They're just doing what they want to do and not taking the time to think before but it's really not by choice. It's just they legitimately cannot stop and make the decision to think about it first. So because of this impulsiveness, children with ADHD are more likely to get in trouble. They'll lie, ditch school, run away, steal. And it's not necessarily because they're bad kids or think that these things are okay, but they simply just do not think about it before they do it. They just do it and act on impulse. And they'll find themselves in dangerous situations also. So, like jumping into the deep end of a pool if they have no idea how to swim, or taking apart some type of toy without having any idea how to put it back together. Inattention is another factor of ADHD. So, basically, an extremely short attention span. So, they can't pay attention for longer than a matter of minutes. They're unable to stay on task and focus on the task at hand. You may notice that your child can sit in front of the TV and watch TV for hours or play video games for hours, but as soon as an activity that requires any kind of conscious effort is presented, all the focus goes completely out the window. They're easily distracted. For example, they'll sit down to do homework and there'll be a ticking clock across the room and now all the attention is on this clock. Okay, even if the clock is removed from the room and they can go back to homework, it's only a matter of time before they find another distraction. Small projects could take multiple start attempts and days to finish when they could really be finished in 15 minutes, like a really short thank you letter to grandma and grandpa that would take no more than 10 minutes could take a week to finish. They'll tune a teacher or you out when you're talking just because they are trying to actively listen, they just can't stay on task or concentrate on one thing at a time. They'll forget and lose everything because they'll set down their bike at the park and to pick something up and just completely walk away from their bike because their mind is now on something else. Excitability is frequently what makes dealing with ADHD the most difficult. Long and short of it, your child is easily upset. They have little tolerance for frustration, and they'll act on this frustration without thinking in an instructive manner. So, for example, if a toy doesn't work right then, they'll just toss it across the room and completely destroy it. They'll have mood swings where you can ask about the weather, and it's just a simple question or a statement, it's sunny outside, and all of a sudden you're in a argument about whether or not it's actually sunny outside or what the weather is like. And children with ADHD frequently have difficulty making or maintaining friendships because their behavior is interpreted as immature or babyish. So managing ADHD. There is no cure for ADHD, but there are ways to manage the disorder. Medication is an option, and some people are opposed to medication for children, but it is always an option. Behavioral therapy is always recommended, but using medication alongside behavioral therapy at the same time is proven to be the most effective. So medications. Stimulants are the best known medication that are provided for ADHD at this time. So Ritalin is one of the more common ones, and it works by attempting to boost communication rate between the dopamine cells, receptor cells, and this improves attention, concentration, and self-control. Basically, the medicine binds to the receptors and it inhibits the reuptake system, so the dopamine that is released is now being communicated to the nearby cell. Ritalin lasts about 4 to 5 hours, and you could be taking multiple doses a day. Frequency and dosage varies depending on what is prescribed. Considered as the long-acting version of Ritalin, but is taken once daily and lasts about 8 to 12 hours. Adderall is another very common medication for the treatment of ADHD, but it's twice as strong as Ritalin. It has the same medication as Ritalin as far as it binds to the dopamine receptor cells and boosts the communication rate, but it also increases the amount of dopamine that's released from the cells. So it lasts about 4 to 5 hours, just like Ritalin, and you could have multiple doses, and frequency and dosage varies depending on your whatever is prescribed. Adderall XR is the long-acting version of Adderall. It's taken once daily and lasts about 8 to 12 hours with a steady stream of medication throughout the day. The possible side effects of stimulants are loss of appetite, nervousness, insomnia, anxiety, and agitation. Non-stimulants are also used for the treatment of ADHD. They can be used in place of stimulants or also as alongside stimulants. They have less side effects and can last up to 24 hours. Strattera is a frequently used one. It increases the amount of norepinephrine, which is also a neurotransmitter in the brain, helping increase attention level, impulse control, and decrease hyperactivity. Non-stimulants seem to have a smoother effect than stimulants because there is no abrupt take effect or come down. They don't cause sleeplessness or agitation and have a lower risk for abuse. And possible side effects include decreased appetite, mood swings, nausea, dizziness, upset stomach, and fatigue. Antidepressants are also sometimes used or prescribed for the treatment of ADHD, or they're sometimes prescribed alongside stimulants and alone. There's many different options of antidepressants or routes that you can take, but they do carry many side effects and risks, such as suicidal thoughts or suicide in children. And if this is recommended, talk to your child's doctor about possible side effects and risks. So managing ADHD also is managed really well with behavioral therapy. Behavioral therapy is the most commonly used as well as the most effective when it's used with medication and by itself. So the first thing you can do is create a routine. Children with ADHD need consistency and structure. Following the same routine from the moment they wake up all the way until they go to bed will help your child understand when it is appropriate to do certain things. Creating a chart to show times and what activity is accomplished will help your child understand what needs to be done at what time. Organizing. Have things organized, have a specific place for common daily items like backpacks, shoes. Labeling them will also help your child know that everything has a place and needs to be put away. Also give choice but not limit them. So when you're giving choices, for example, give them 2 options for what they might want to wear so they have the choice and independence to choose between the 2, but they're not overwhelmed by choices. Avoiding distractions, so turning off the TV, video games, etc., will help your child focus on the task at hand. This is especially helpful when trying to get things like homework done. Changing the way you talk to your child is also something to consider. We've established that your child's attention span is most likely short, so giving long, wordy explanations for instructions is a waste of everyone's time. Try giving your child commands and directions that are clear and concise to help your child better remember. Using goals and rewards is also effective. Creating a chart with your child's responsibilities is a good idea. Listing chores, tasks, positive behavior, and this allows your child to check off what they have accomplished. Using things like stickers or a whiteboard where your child can physically check off what's been done and what was accomplished, and also see when, if it wasn't done, what they did wrong. Using appropriate, efficient, and consistent discipline is also really effective in managing ADHD. Avoid spanking and yelling at your child. Having a designated timeout chair and using it consistently. Taking away privileges when inappropriate behavior is displayed. Younger children can be ignored when they're acting out or distracting them. Can also be helpful for discouraging inappropriate behavior. Helping your child find a hobby or a talent. Children with ADHD are easily discouraged and sometimes will feel stupid. If you help them find something that they're good at or something that they enjoy, it can give them a huge self-esteem boost as well as help with social skills, whatever it may be, if it's music, sports, art, anything like that. And lastly, having patience. Losing your cool and yelling basically solves nothing. Having patience when dealing with your child, even when they're acting out or being difficult, can be most beneficial for everybody. Lastly, using medication and behavioral therapy combined is proven to be the most effective when managing ADHD. Consider talking to your child's teacher about setting up a behavioral contract so there's consistency in the environment between home and school. Obviously, we know if there's a problem at home, there's most likely, if not more so, a problem with things like attention, hyperactivity, impulsivity at school too. So collaborating with your child's teacher will be the most helpful for having your child succeed in school, as well as helping your child's teacher understand your child. Parenting children with ADHD can be incredibly difficult and frustrating, but it is not impossible. Setting up an environment for your child that is structured, consistent, and organized will be the most beneficial for the entire family. And I think most of all, what's most important is knowing that your child needs you, even when they can be extremely frustrating and difficult, is the most important thing to remember when parenting a child with ADHD. Overall, something to talk about. Basically, you need to talk to your doctor, talk to your child's doctor, and discuss medication, whether or not you want to go down that route, and acting on that using behavioral therapy as well to manage your child's ADHD are the best ways to manage it. And that is it. Thank you.